You want to speak? So not them to rise now. Why do this? When they start from at what point do I say at what point do I say the mouse rules? First they no, where do you go? I'll tell you about it too.
May we all rise as we begin the procession? Thank you.
Now we have the national anthem. Thank you very much, the band. We can have our seats. Ladies and gentlemen, you are welcome to the 26th annual faculty lecture of the Faculty of Ophthalmology, National Postgraduate Medical College of Nigeria. Of course, today we shall be discussing on force majeure, masquerades, and the attainment of universal care in Nigeria. We want to thank you all for gracing this occasion, and we are happy to have all our dignitaries here, all our fellows, both gown and ungown, families, and friends of both social clubs and academic clubs, and all invited organizations and companies. Thank you for joining us. We also appreciate those of us who are online, who are unable to be here or are planning to get here. It is indeed a hybrid event. So those online, we appreciate you. We thank you for joining us. At this juncture, we shall be introducing our dignitaries. Ladies and gentlemen, join me as I call a very important personality, the one and only, who will sit at the helms of affairs for this occasion. I present to you a man who was born in London but currently resides in Nigeria because of his love for Nigeria. He has impacted the health and business sectors. His illustrious career spans decades and is characterized by unwavering and determination, whether in the capacity of medical practitioner or as an entrepreneur or as a construction tycoon. He is the founder of Dogs Project Limited, a company initially specializing in revitalizing top-tier hospitals across Nigeria. He is a man of many parts. But join me, because we have everything written down for you in the brochure. But I'd like to invite to the podium, to the high table, the chairman of this occasion, Dr. Afe, to the high table, please. Ushers, please kindly bring our most important man to this high table. Up here, sir. Please kindly proceed to the high table. A very simple man, amiable, loving, and calm always.
Next to be invited to the high table is the Faculty of Ophthalmology chairman, a consultant ophthalmologist, a dedicated anterior segment and cornea specialist at the University College Hospital, Ibadan. Join me as I welcome Professor Charles Bekibele.
We are having a program of the college. Without the college, we cannot be discussing the faculty or its lecture as it is. To sit on the academic part of all we are doing today and to superintend on it is the president of the National Postgraduate Medical College and all officials as here. The president ably represented by Dr. S.S. Sule, while also we have as invitees the registrar of the college, also invited. College is Professor Peter Ndidi Egbeigbe. He is from the Ike South local government area of Delta States, and he completed his residency training in obstetric and gynecology at the University of Benin. He is a member of the several professional bodies: Nigeria Medical Association, Association of Gynecology Endoscopy, Association of Fetal-Maternal Medicine, the World Association of Laparoscopic Surgeons, the International College of Surgeons, and the International Federation of Gynecology and Obstetrics. Ladies and gentlemen, join me as I welcome to the high table the president of the National Postgraduate Medical College, Professor Peter Ndidi Egbeigbe, represented by the Deputy Registrar Academics of the Postgraduate College, Dr. S.S. Sule.
The next to be welcome to the I table is our special guest of honor for today. I don't cite him. He's not here presently, but we would introduce him all the same. Um, okay, is represented. Okay, represented. He's an illustrious personality, not just in the world of ophthalmology, not just in the world of ophthalmology, but all around as far as you can think. He's an international acclaimed ophthalmic surgeon with wide experience in vitreoretinal surgery, glaucoma, anterior segment, cataract, and ocular plastic surgery. He is a fellow of the Royal College of Surgeons, Glasgow, UK, United Kingdom, Royal College of Ophthalmologists. Is the founder, chief medical director of Eye Foundation Hospital Group, a leading and internationally recognized multi-specialist eye care hospital and training center in Nigeria. Is no other than Dr. Kunle Hassan, ably represented by Dr. Femi Oderinlo. Can we please, a consultant vitreoretinal surgeon as well. You're welcome, sir.
Ladies and gentlemen, join me as I welcome to the high table one of us, an Amazon, blazing the trail, both nationally and internationally. She is the MD CEO, Medical and Dental Council of Nigeria, and the brand new president of the International Agency for the Prevention of Blindness. Join me as I welcome to the high table Professor Fatima Kyari. I think we have gotten to where, please, a round of applause as she moves to the high table. Ladies and gentlemen, join me as I call on a mother of mothers, professor of professors, past president of the National Postgraduate Medical College, a doyen of ophthalmology, my great grandmama. I go great grandmama, whichever one, but she's that great. I invite to the high table to join us my mommy, Professor Ajeshola Majekodumi.
You're welcome, ma. If she's your great grandma, then what's she to me? Then she's my great grandma.
No, we need genetics to look into that. So we know the generation you are. I can't name your generation yet. Yes, it is time to call on that man on whose name and personality we are all here today. We already know him, but we need to know more of him. And he wants to tell us about his journey in ophthalmology. I will not do much because we still have a time where we shall read his citation. But he is a man who, when he speaks, you will think God is talking to Moses. He is the faculty lecturer for today, our one and only Dr. Festus Oshoba. I invite him to the high table. Thank you. A round of applause, please. A thunderous one.
Thank you very much. Before we proceed, I'd just like to familiarize us with the house rules. Let's kindly put our phones on silent, and the conveniences for male and female. The female we have on the extreme left, while for the male is situated on the extreme right of the hall. If we have any questions, we need answers to some confusions. We have the ushers who will be readily available to attend to our various concerns. Thank you very much.
Join me as I recognize in sitting the Deputy Vice Chancellor, Developmental Services of the University of Lagos, ably seated here, Professor F.E.A. Leshi, one of the friends of the lecturer. He is the chairman of the Medical and Dental Council of Nigeria. Ladies and gentlemen, join me to recognize in sitting here past chairman of the Faculty of Ophthalmology. We have Professor Adeola Onokoya, MC. We have the immediate past chairman of the faculty, Professor Ajibode. Also seated here is our current secretary of the Faculty of Ophthalmology in person of Professor Adekoya.
Next, we'll call on the faculty chairman to give us his remarks.
We are going to give you that. Oh, let me hold it.
Okay. Okay, let me just. The chairman of today, Professor Unji Olowolafe, President of the College, National Postgraduate Medical College of Nigeria, Professor Ndidi Peter Ebegbe, ably represented by the Deputy Registrar Academic, Dr. Sule. Past President of the College, Professor and Mother of Ophthalmology, Professor Adeshola Majekudobi. Registrar of the College, Registrar of the Medical and Dental Council of Nigeria, faculty lecturer, special guests for today, Professor Kunle Hassan, past chairman, Faculty of Ophthalmology, all special guests of the occasion, ladies and gentlemen. Dr. Olatunji Kayode Olowolafe, we are pleased and humbled to have you with us. Our faculty lectures are an annual event which are delivered by distinguished fellows of the faculty who have been seen to be of great service to the faculty and are honored in their places of residence with the opportunity of giving the lectures on any topic of their choice. The occasion is also used as an opportunity to raise funds for training and other activities. Training needs of our faculty is huge. With a population of over 200 million Nigerians, with 400,000 having operable cataracts, but only about 500 certified ophthalmologists, and only about half of them actively carrying out cataract surgery. Due to several barriers, including poor outcome, The faculty is determined to improve the surgical outcome of its trainees and fellows. One of our accredited training centers at Ibadan, the Eleta Eye Institute, was recently promised a simulator-assisted cataract surgery training machine, which is expected to revolutionize cataract surgery training with subsequent improved outcome in Nigeria. However, more of this equipment are needed, both at the college and in other regions within the country. We are therefore using the opportunity of today's lecture and the launching of our endowment fund to request your kind support and generous donation towards acquiring this equipment, whose cost is over $100,000. We are also using the occasion of today's lecture to honor some of our fellows who successfully anchored our update courses for many years. This includes Dr. Adiola Onokoya, Dr. Ernest Omoti, and Dr. Ayobade Ogundipe. Also deserving of our honor is one of our past faculty chairmen, OSCE committee chairman, and internal assessor for fellowship exams, Dr. SNN Osu, who only this April retired from the Nnamdi Azikiwe University Nnewi after achieving the mandatory retirement age of 70 years. The winners of our annual Oshitoku quiz competition, which took place at the Guinness Eye Center yesterday, are also to be honored today. On a final note, the faculty would like to appreciate in a special way the 2025 annual faculty lecture, Dr. Festus Oshoba, for his numerous support and for hosting us in Lagos at the faculty lecture this year. The year 2026 faculty lecture. The Faculty Board of Ophthalmology has approved the nomination of Dr. Harun Adetunji Ajibode, immediate past chairman of the faculty, as the year 2026 annual faculty lecturer. Dear senior colleagues and colleagues, here present, our honored guests, ladies and gentlemen, I thank you all for your presence today, both physically as well as online. Thank you all for your attention. Okay.
Thank you very much, our faculty chairman. Apologies for that pathway. We want to say that anyone who is coming to use the podium should kindly use the stairs, or we bring the mic to you where you are. Apologies for that. Ladies and gentlemen, join me to recognize members of the Egbe Boba Keye that are presently seated here. And we also recognize the University of Ilorin alumni who are ably seated there. Please kindly raise your hand for recognition. Also, we want to recognize those who belong to our iBank, the dignitaries at the iBank. Kindly raise your hand for recognition. I want to welcome to this occasion my one and only chairman, the chairman of whom probably I won't have a state branch to belong to. He is no other than the chairman of Ophthalmological Society of Nigeria, Lagos State Branch, Dr. Yinka Shonayevon. Right about now, we move to the next thing on the agenda. You do that. By calling on the president of the National Postgraduate Medical College of Nigeria, ably represented by Dr. S.S. Sule, the Deputy Registrar Academics, for his remarks. Please.
Thank you. Good morning, ladies and gentlemen. I stand on all existing protocol that is duly observed. Esteemed Chairman of the occasion, Dr. Kayode Olatuji Olowolafe, the Chairman, Faculty of Ophthalmology, Professor Charles Bekibele, the Secretary, Professor Adekoya, and board members of the Faculty of Ophthalmology, our eminent guest lecturer, my Oga, Dr. Festus Oshoba. I also want to recognize our past president of the college, Professor Majeko Dumi, distinguished fellows and associate fellows of the Faculty of Ophthalmology of the college, invited guests, friends of the college, and Faculty of Ophthalmology, ladies and gentlemen. It is with great pleasure and a deep sense of professional solidarity that I deliver this good message on behalf of the college president, Professor Ndidi Peter Ebegbe, and the college registrar, Professor Temitope Eson, of the National Postgraduate Medical College of Nigeria. At this important 26th annual lecture of the Faculty of Ophthalmology, taking place today at the Nebu Hall, Abati Barracks, Surrey, Lagos. The annual lecture series of the faculty has over the years become a platform of intellectual discussion, debate, and distinction. A gathering where bold ideas are shared, topical challenges are explored, and the future of specialist training and service delivery in ophthalmology is envisioned. Today's lecture, with the evocative theme, Force Majeure, Masquerades, and the attainment of universal healthcare in Nigeria, promises nothing less. We are especially honored to welcome our eminent guest lecturer, Professor Festus Oshoba, a respected figure in ophthalmic care and training, whose contribution to the field continues to resonate both within Nigeria and beyond our borders. His unique perspectives, shaped by years of clinical, academic, and administrative experience, is certain to provide thoughtful engagement and offer direction as we continue to confront the realities of healthcare systems strengthening in Nigeria. The theme of today's lecture speaks to the layered complexities, natural, systemic, and sometimes cultural, that influence access to healthcare in Nigeria. It challenges us to critically assess not only the obstacle, but also the opportunities on our path towards achieving universal eye care. This goal is consistent with the broader objectives of universal health coverage and the Sustainable Development Goals. The college deeply appreciates the Faculty of Ophthalmology for sustaining this important tradition of scholarly reflection and advocacy. Your commitment to excellence in postgraduate medical education and specialist training is exemplary and continues to enhance the college standing nationally and internationally. On behalf of the college president and the college registrar, I wish to assure you that the college remains steadfast in supporting the faculties in the academic pursuits. We continually work to enhance an enabling environment for training, assessment, and research, and we encourage ongoing innovation and collaboration within and across specialties. To all participants, fellows, residents, students, and guests, I thank you for your presence and engagement. Let this event not only inform us, but also inspire us towards action. On this note, I congratulate the faculty once again and look forward to a stimulating lecture and productive discourse. Thank you and God bless.
Thank you very much. Thank you all very much. Before we, I'd like us to recognize the presence of some dignified personalities. An elder, professor of professors who just recently retired, but definitely not tired. He's a consultant ophthalmologist who has greatly impacted the training of ophthalmology in Nigeria, in person of Professor Ten N. Nwosu. You're welcome, sir. Also, I'd like to recognize the president of Ophthalmology Society of Nigeria, Dr. Abiola Oyeleye, who is ably represented here today by Dr. Gloria Ferife, the Vice President. You're welcome, ma'am.
Thank you. At this juncture, we would like to hear from our chairman of the day. That's the chairman of the occasion, Dr. Tunji Olowolafe. She walks to the podium. I recognize again all fellows, gowned and ungowned, families of the lecturer, all invited guests. You are welcome.
Good morning to you all. I will recognize Dr. Kunle Azan, if he's ably represented here, our special guest of honor. I understand that Dr. Sule, the Deputy Registrar, is representing our chief host. Dr. Bola Adekoya, the Faculty Secretary. We were both at the Youth Corps Service in 1984. All protocols duly observed. Before I go into the speech, actually, my glasses has some challenges, but I understand that we only have 454 fellows in the Ophthalmology Society. We will deal with that as we go down the line. I need to make a few corrections. Dr. Tunji Adenekon exaggerated all that he said. But again, one of these days, I'll put a proper bio so that it will be accurate. Dr. Charles Bekibele called me a professor. So the Christians will say, I claim it. Professor. I think this is one of, most times when I chair occasions, I'm probably the only doctor. But I still don't know why a doctor would chair an occasion where there are professors and there are fellows. And I understand to get fellowship, to have done 6 years after graduation. You would have spent 5 years in medical school, 1 year internship, 1 year youth corps, then another 6 years. So I was wondering, out of 220 million, how would 454 people take care of our eyesight? So those are challenges of the time. Ladies and gentlemen, I give all the glory and honor to the Almighty God for the gift of life and for making this day a reality. I also thank the organizers for the privilege of chairing this important occasion where gown meets town. The Postgraduate Medical College of Nigeria, NPMCN, established by law in 1979, stands as the apex institution for postgraduate medical education in Nigeria. Through rigorous training and examinations, the college has produced specialists across all fields of medicine and dentistry. The Faculty of Ophthalmology has since 1969 certified only 454 fellows. Nigeria is growing at 2.7% per annum. Nigeria today has a population of about 220 million. There are 6 million new children with eyes every year. So we need to take note on how to correct the imbalance. I'm informed that this annual lecture series is one of the faculty's strategic efforts to bridge the gap by raising awareness, attracting institutional and philanthropic support, and strengthening ophthalmology training. The annual faculty was instituted to promote ophthalmology training and access to eye, to encourage partnerships and sponsorships. to honor outstanding fellows, to raise funds for educational institutions, to support residency training through updated equipment, resources, and workshops. Since its inception in 1997, the lecture series has featured thought leaders who have addressed themes spanning glaucoma, cataract, blindness, diabetic eye disease, training standards, and sustainable eye care delivery. Today marks the 26th lecture in this prestigious series. Dr. Odunayo Festus Oshoba, a great friend of mine who we knew when we were in medical school, that he wasn't stopped. Now I know why you were very studious in 1979. Dr. Festus Oshoba will speak on a timely and powerful topic: force majeure, masquerades, and the attainment of universal eye care in Nigeria. I understand the faculty plans a surgical simulations center, a critical gap in improving cataract surgery and training. This center will have ophthalmic skills as well as high fidelity tools, eye surgical simulator, which is estimated at $100,000, and microscopes estimated at $25,000. This lab will enable world-class training in cataract, oculoplastic surgery, and refraction. This lab will facilitate the world-class training in cataract surgery, oculoplastic procedures, and clinical refraction techniques. Cataract remains the leading cause of preventable blindness in Nigeria, largely due to shortage of well-trained ophthalmologists and also the number 454 out of 220 million Nigerians. This simulation center is a bold and necessary step towards addressing that challenge. So I was recently made Chancellor of Ekiti State University, and a lot of people had now associated me with the academic society. Up until then, I was just doing my little shop business and managing myself, like we say in Nigeria. When I got that appointment, that was when I realized that we needed to also give back to the society. So I'm associated with a foundation called Tunji Olowolafe Foundation. I hereby commit to associating with the Simulation Center in honor of my late wife, who recently passed the 11th of March 2025, Mrs. Gbemisola Olowolafe, in pursuit of our mission. That's the Tunji Olowolafe Foundation, healthcare, and sustainable development in Nigeria. And I'm always proud to say I'm from Ekiti State, and specifically Are Ekiti. And we remain committed to the transformative and lasting investments. And we would make sure we donate not more than $125,000. Thank you. Thank you. Thank you. Thank you. So, nostalgia, when we were in school, I'd never seen a professor stand up. Thank you. Thank you. I warmly congratulate my friend, my brother. His wife is here. Madam, I congratulate you. He's a fellow alumnus of University of Ilorin, Dr. Odunayo Festus Oshoba, and wish him eloquence and excellence in his delivery. It is my honor and privilege to declare the 2025 faculty lecture open. Thank you, ladies and gentlemen.
Thank you very much, Mr. Chairman, sir. We are indeed very grateful for that very generous. In fact, I don't know what the adjective to describe that, but we are blown away. We are very grateful. Thank you, sir. Now it's time for the lecture. Before we have the lecture, we're going to have the citation of the lecturer, faculty lecturer for today. And to give us the citation is one of us, our very own, a dedicated trainer, my trainer, a consultant ophthalmologist and retroretinal specialist par excellence, who has just been recently promoted to a well-deserved position of Associate Professor of Ophthalmology with the College of Medicine, Louth, is no other than Dr. Adetunji Adenekon.
Thank you. She forced me to sit down so that she can introduce me. I'm still the same MC you have seen before. Thank you. May I ask thank you. Of you who are here, you have the opportunity to see him live, while those online are watching him virtually. I read the citation of the lecturer for the faculty today. It is indeed an honor to be the one to do this. I like doing it. If you like me, ask me to do your citation, because that's the only time I can order you to stand, even as my teacher. Dr. Festus Ipuayo Abimbola Oshoba was born on the 26th December 1958 at Odoekpo via Ijebu-Ode Odogbolu, Ogun State. Preschool living certificate at the St. Peter's, SS Peter and Paul Primary School, Ile-Ife, Osun State. He proceeded for his secondary school education at the St. John's Grammar School, Ile-Ife, Osun State, where he bagged his senior school living certificate in 1976. For his quest for more knowledge, he proceeded to the University of Ilorin, Kwara State, Nigeria, for medicine and surgery, and he bags his MBBS degree in 1984. Of course, he's a compulsory national youth service. He served at the Lagos Island local government in the year 1985, but found a space and a quest for more knowledge and a keen interest in ophthalmology, and eventually proceeded to the Lagos University Teaching Hospital, where he has his postgraduate residency training. And in the year 1992, he bagged his fellowship of the West African College of Surgeons. And in 1993, he bagged the fellowship of the Medical College of Ophthalmology, Postgraduate College of Nigeria. He didn't stop there. He tried to improve himself in statistics. He decided to obtain a certificate of EpiInfo in 2002. He went again to get a certificate in ocular sonography in 2005, and he tried to be a manager by going for the advanced management consulting course in September 2006. This man did not stop there. This is one of the things I wish to be like. He wasn't okay. He decided to go into law. He bagged the Bachelor of Law, LLB, at the National Open University of Nigeria in January 2015. Then went on to a postgraduate diploma in broadcasting journalism with distinction. So some of you are in the LOC. You now see why he's arguing with us about media. He is himself a journalist. He decided to be an administrator. He bagged the third administrator degree by the Third Institute of Administration of Nigeria in 2007. He went into public administration with a master's in public administration at the University of Lagos. At the University of Lagos, where he bagged the Masters of Public Health. Then he proceeded to Rotary Eye Hospital and Research Institute in India, where he majored intraocular lens implantations, microsurgery, manual small incision cataract, and a certificate in cataract phacoemulsification surgery. This man did not want to stop. I can assure you, in a matter of minutes, you are going to hear another set of degree. He is a consultant special grade 1 at the Lagos State Health Service Commission under General Hospital Lagos. He is a Lagos State former program coordinator, Lagos State Committee for Prevention of Blindness, former head of department, General Hospital Lagos, past registrar, Medical and Dental Council of Nigeria. He has won many awards. He won the Federal Government Merit Award Scholarship for Outstanding Academic Performance in 1981, 1982. He had the Silver Gigi Prize for National Essay for Medical Students in 1983. The following year, he got the prize, the award again for the National Essay on Healthcare for All, its concept and responsibilities. He also won the Duro Sholeye Best Prize, Best Student in Public Health, and the Faculty Prize for overall Best Student from the Faculty of Health Science, University of Ilorin. He has a Special Merit Award for his service with the Ophthalmological Society of Nigeria, Lagos State. He is the first of Ilorin University Medical Student Association, Editor-in-Chief, past President, past Vice President of Nigeria Med Student Association, which is NIMSA. And if you look at him, even though you see a lot of drama, I'm not saying he's being dramatic, but he loves drama. He is the lead actor in Lanke in the 1982 convocation play of the University of Ilorin, titled The Palm Wine Drinkard, written by Kola Ogumola and translated to English by. He is a past chairman Medical Guild, pioneer secretary and past chairman of Ophthalmological Society of Nigeria, Lagos State Branch, past secretary general of Ophthalmological Society of Nigeria. He is the deacon of the Assemblies of God, Oyinbo, Lagos. He is the immediate past first vice president, Health Federation of Nigeria, past secretary general and immediate past first vice president, Guild of Medical Directors, and he is the past president, Chartered Institute of Administration. This man is just too much. Currently, all these past, let's come home. He is the trainer of resident doctors and diplomats in ophthalmology. Like I said, a consultant, special grade 1 in General Hospital Lagos. He is the current secretary of the Board of Trustees of Ophthalmological Society of Nigeria from 1998 till date. He is the chairman, Board of Governors, the Eye Bank of Nigeria. He is the member, medical subcommittee of Nigerian Olympics in 2004 till date. He is a member, Governing Council, Chartered Institute of Administration, and many of his committees. He is a reviewer for the Nigerian Journal of Ophthalmology from 2004 to date, and he is the MD, CEO, Latkem Eye Hospital, Surulere, Lagos. He is a member of American Academy of Ophthalmology, Fellowship of the International College of Surgeons, full member of the Nigerian Institute of Management. He is a fellow Institute of Administration and an associate member of the Institute of Management Consultants of Nigeria. He has given addresses at many international conferences and events, training workshops, respectively, such as World Ophthalmology Congress, All India Ophthalmology Conference, Pan-African Arab Council of Ophthalmology, including attending the Athens Olympic in 2004. He has many research publications and articles credited to his name. He is married to Mrs. Elizabeth Bandele Oshoba and blessed with 4 children. His hobbies are reading. We know that table tennis, drama, I mentioned the lead actor, and lawn tennis. When you see him kitted, you would think he has won many Grand Slam, but he's just a coach of those who have won the Grand Slam. He is into farming, snary and small-scale fishing. Ladies and gentlemen, I present to you an enigmatic, energetic, resilient, versatile, and sagacious man of honor, a chartered administrator, legal luminary, and dedicated comprehensive ophthalmology with subspecialists in arterial segment and cornea with panache and finesse. Dr. Festus Odunayo Abiola Oshoba, MBBS, LWACS, FMCF, FICS, FICA, MNIM, MPH, PGD, boss of many bosses, philanthropist, industrialist, and highly supportive senior colleague. Thank you, sir.
Good morning, everyone. Can I have the slides, please? Let me stand on protocols that have been established. And let me thank Professor Dinekon for the profile. I'm grateful to you. I want to thank everyone here for being here to witness this occasion, especially my brother and friend, a man of impact, very quiet, but highly effective, Dr. Tunji Ololafe. He has just lifted us up. Our dream, our hopes, he has assured us is going to make it come true. I would like us to rise for 1 minute in remembrance of his dearly beloved wife that passed. Shall we all rise, please? May the soul of our dearly beloved sister, Demisola Ololafe, rest in perfect peace with all the other saints departed. We may be seated. I need to acknowledge my roots. Mommy, Professor Maya Kodumi, I thank you so very much. And I'll tell the story of how I came here. So at the University of Ilorin where we trained, we didn't have really ophthalmologists there. So I wanted to become a gynecologist. So I went for fellowship for primaries, West African College of Surgeons in obstetrics and gynecology, and passed at the first attempt. Then I went to LUTH. I said, I'm here. And they said, no, but we don't recognize West African primaries. You need to go and do national. 6 months later, I came, oh, I have passed the national. Please take me. They say, this question of obstetrics and gynecology is reserved. But the chairman of the board then now told me that, look, we have Professor Maya Kodumi. Many of the, or most of the residents are women. You are a man, you won the Droshuler Prize, and the chairman of the board then was Dr. Droshuler. He said, why don't you go and meet Professor Maya Kodumi? I'm sure that she'll be willing to accept you. So, also at the Lagos State Health Management Board, where I was employed and working at that time, I told them that, look, I have primaries in obstetrics and gynecology. This is what I want to do. But the man there said, look, we only have vacancy at the eye clinic. Take it or leave it. And at the eye clinic, I was, and let me recognize, mommy, please stand up. Dr. Mrs. Nana George. She is my mother, my mentor, my guardian, and the angel that the Lord has said to me. She gave me all her books, including Dr. Idewu, all of them, Dr. Domingo, and they make sure that I passed. And mommy, thank you for accepting me when I came and presented myself. I'm most grateful. We have here, we have people from the Chartered Institute of Administration. We have from the iBank and so many others, family who have been recognized. My colleagues, mentors, Professor Nwosu, thank you so much for everything. And members of the LOC, I'm so grateful. Today's lecture is about the topic force majeure, masquerades, and the attainment of, the slide is not moving, and the attainment of universal eye care in Nigeria. So, you still see that I have a diversified background. So in law, a lot of lawyers like to talk about force majeure. So that is, if you have a contract with somebody, you're able to perform or a disaster or war, then you are exempted from facing penalties. And the dictionary has said that, look, when you talk about force majeure, it's talking about something that is like a superior or irresistible force, an event, effect, which you cannot be reasonably anticipated or controlled, and therefore is compared to an act of God. Also, when we talk about masquerades, in Africa, there are masquerades everywhere. In Lagos, we have your masquerade and all that. But the dictionary defines it as something that connotes a false show, a pretense, a deception, a front, a facade, a disguise. Talking about universal eye care, which is a concept that aims to ensure that all people have access to eye care services they need, when and where they need them, without financial hardship. And it is a crucial component of universal health coverage, which is a global priority of the World Health Organization and a key enabler for achieving the Sustainable Development Goals. Nigeria has adopted universal eye care. It is incorporated by the Federal Ministry of Health, the National Council on Health, and it is something that we are in the process of implementing. And it is about giving comprehensive eye care services through health promotion, through education, prevention, treatment, rehabilitation, and rehabilitation, treatment for visual loss, and enable people to adapt. The slides, okay? Yes. Also, it requires that there should be a wider integration into the wider health system, particularly primary health care level, which means training and retraining of primary care staff in basic eye care, establishing robust referral systems to secondary and tertiary facilities for more complex cases, and then, as mentioned, including eye health in national health policies and planning, budgeting, and making sure that it is done, such that everybody can have access and equity in eliminating barriers that prevent people from getting eye care, including socioeconomic status, geographical locations, vulnerability. So, universal eye care is to ensure that we can shine our eyes and see well. When we see well, we can appreciate our environment, we can be more productive, we can have increase in the GDP, and maybe one day we become also the happiest nation on earth as we were identified in the past. Next slide. It has to also have a people-centered approach and ensure that blindness and low vision is prevented as much as possible, and when it happens, we can rehabilitate. Next slide. Next slide, please. Yes, yeah. This is not doing it. In summary, universal eye care is a comprehensive, equitable, and integrated approach to eye health that ensures that everyone has access to the service they need to maintain optimal vision and prevent avoidable blindness, ultimately contributing to overall health and well-being. And the essence of this lecture, therefore, is to emphasize the fact that whereas red eyes, ocular injuries, foreign bodies, many systemic diseases with ocular manifestations, they are not among the top main causes of blindness and visual impairment in Nigeria. Their proper identification and management is a sine qua non to the attainment of universal eye care in Nigeria. Next slide. This faculty lecture is a platform and a forum where members can present an account of their stewardship, which I already mentioned in my introduction. Next slide. Next slide. Next slide. Well, a lot has been said about this. Next slide. So, my dissertation was on red eyes at the Lagos University Teaching Hospital. And red eyes and ocular emergencies often present themselves as a force majeure, as an event or effect which cannot reasonably be anticipated or controlled, and which can be compared to like an act of God. To elaborate on this, I will proceed to present my experience in managing red eyes and ocular emergencies over the years. Between 1991 and 1992, my dissertation for the award of the fellowship for the National Postgraduate Medical College of Nigeria was on analysis of red eyes seen at the Lagos University Teaching Hospital. Next slide. And about 12 years after I carried out my own studies, Dr. Mose Badudu did something similar, almost replicated at the General Hospital Lagos. And the results were, in fact, strikingly similar, because for Dr. Badudu, between 2003 and April 2004, she saw a total of 830 new patients with red eyes. Whereas when I was carrying out my own studies in between 1991 and 1992, 582 patients were seen at LUTH. Next slide. So red eyes accounted for about 17% of new cases, like 1 out of every 6 patients in 2003, but 27.92% in 1992, 1 in 4 patients seen, suggesting that over improved facilities and personnel in the incidence of red eyes. Next slide, please. We now look at some of the highlights of the work carried out. Next slide. So we can see between April 1991 and March 1992, Festus Oshoba, and May 2003 to April 2004 at General Hospital Lagos, Dr. Bose Badudu. the number of patients that were seen, and the percentage with red eyes. 27.92% in 1992 and 17% in 2004. The age range of the patients were similar in both studies, and the male to female ratio relatively similar, 1.2 to 1, and then 1.8 to 1 12 years later. So still male preponderance. The age range deviated because in 1992, the mean age was 21 years, whereas by 2004, it was almost 33 years. What were the leading causes of red eyes? The most important one is injury, responsible for 38.5% in 1992 and 52.3% in 2004, followed by conjunctival disorders, then corneal disorders, corneal foreign bodies, uvea disorders, secondary glaucomas, other ocular infections, acute glaucoma, peripheral blind eye, orbital diseases, ocular tumors, eyelid disorders, and lens disorders. Next slide. So, out of the 582 patients in 1992, the male to female ratio was 2 to 1, whereas 12 years later, it was 1.2 to 1. And then patients with red eye represented 7% of the total clinic attendance at that time. And so the difference between, despite 12 years gap, was very, very minimal. Next slide. So also, in all the cases, there were more females, there were more males than female. And the diseases that caused mostly red eyes were injuries, conjunctival disorders, corneal diseases, as earlier emphasized. Next slide. Again, just emphasizing the fact that there were more female than male as seen at the General Hospital Lagos. Next slide. Again, when we look at the mean age distribution, that was emphasized already, that 21 years in 1991 and about 23 years later. Next slide. We have already emphasized on the leading causes. Next slide. Again, when we now say injuries, what type of injuries are we talking about? Blunt injuries, chemical injuries, foreign bodies, penetrating injuries, and terminal injuries. When it comes to blunt injuries, let me just give us an example of what happens. So many times, maybe when you're at the bus stop or somewhere, we have people gathered. You will see them talking. You say, "Mako gbaju," you know. And actually, when people say that, they slap the person, they hit the person on the face, and many people lose their sight because of this. So we need to ensure that in the society, we are less aggressive. And if we want to play or do whatever, we should respect the facial region and avoid it, because the damage may be irreversible. Again, we have had a lot of chemical injuries, and many times it's associated with complications. In the front of the eye, we can have things like iritis, foreign body, subconjunctival hemorrhages, ephema, lacerations, cataract, secondary glaucomas, corneal abrasions, iridodialysis, and subluxated lenses. Next one, we can also have posterior segment complications such as vitreous hemorrhage, ruptured globe, commotio retinae, retinal detachment, retroborder hemorrhage. Some people have macular hole or macular scars. Some people have intraocular foreign bodies and cranial nerve palsy. 2 patients had blowout fracture of the orbit. That means where the eyeball is sitting is damaged, and therefore it tends to sink downwards. Next slide. Again, patients that have had injuries and they often have blood in the anterior chamber or blood inside the eye, in front of the eye, which is called ephema. And we can see that when you compare with the contralateral eye that did not have the injuries, ephema leads to raised intraocular pressure because the red blood cells, they actually block the drainage angle of the eye, leading to damage to the optic nerve, which, if not corrected, can become permanent. Next slide. So the other thing now is, what are the things that are causing these red eyes? So majority of them actually occur in the home. They're actually domestic injuries from the findings. Then occupational injuries follows. Then injuries are sustained during play, and then road traffic accidents. Next slide. Next slide, please. Again, I need to dwell on this slide for quite some time. So, in our setting, when people have red eyes, curiously enough and strangely enough, they apply human urine. 133 out of 314 patients applied their own urine to the eye. And then breast milk. Some, they put camphor, caphora, cow's urine, onions, palm oil, sugar water, honey, egg, herbal concoctions, aloe vera. Some people have put azal, TCP, rub, and some perfumes. And the issue is that if you have a condition like Apollo, which is a viral infection of the eye, which causes diffuse redness in the eyes, will cause some degree of grittiness in the eye. There is really no decrease in the vision. Even when you don't use any medication, if you can wash your face with soap and water and keep the eyes clean, in 2 weeks, the viral infection will be gone and you'll be back to good health. But when you apply these harmful traditional substances, then what happens? It leads to ocular morbidity and blindness. Don't want in our environment. And to also emphasize on this point, there was a day I was in my village and we were just sitting, and somebody came and told me that, look, I'm having and discomfort in my eye. Doctor, what can I do? A gentleman also, one of us in the village, came up and said, is that the issue? Don't worry, go and put camphor and caphora, put it in water and put it in eye. That was in there. This is a cultural issue. And these cultural issues can only be addressed through information dissemination so that people know that what make the cure of the disease worse than the disease itself is an abomination. And that is what happens when these materials are applied to the eye when you have some red eyes and they are not prescribed. Self-medication. Next slide. Next slide, please. So those who have applied these harmful medications, they develop panophthalmitis, the whole eye is inflamed, abscess in the cornea, painful blind eye, severe keratoconjunctivitis, cornea abscess, fungal corneal abscess, and perforation of the eye. In fact, I'll tell a story here. There was a professor that came to my clinic. Professor was blinded in both eyes. She had Apollo, University of Lagos, the Guinness Eye Center, and she saw Professor Adekunle Oshitelu, who gave some antibiotics for the eye. But after using it fast enough, and then now some people told her to apply sugar water and urine. She applied it, and this professor became blind. For members of the press that are here, please, we need to really be an evangelist to let people know that if you have simple eye condition, go to your nearest eye center, see the eye care practitioners, stop using things that will make the cure of the disease worse than the disease itself. Next slide, please. Again, for the conjunctiva, there are various, you can have bacterial, viral infections, ophthalmia neurotherm, allergic conjunctivitis. This is very, very common. And I used to have a lot of allergy myself. You can also have things like subconjunctiva, hemorrhage, inflamed pterygium, episcleritis, granuloma, Stevens Johnson syndrome, and inturning eyelashes causing red eyes. Next slide, please. During the studies that were carried out, organisms were isolated. Swabs were taken from the eye, and the most frequent organism that was encountered was the Staphylococcus aureus in about half of the patients, followed by Neisseria gonorrhea, and then we also have Pseudomonas aeruginosa and Klebsiella species. These two organisms, they are very highly virulent, and if they are not properly treated, within 24 to 48 hours, the eye can get perforated and become blind immediately. Next slide, please. Again, frequency of corneal disorders that we see: bacterial keratitis with apopion, viral keratitis, fungal keratitis, especially farmers, when they go to the farm and a twig from the tree hits their eye, they just rub it off. But many times they develop fungal infection. So have non-infective corneal ulcers, Moran's ulcers, and as well as measles keratitis. Next slide. Again, we can have secondary glaucomas associated with red eyes that we saw, with complicated cataracts. So people who have cataract usually ask, when can I operate the cataract? Well, the doctor can look at you and advise you on that. But many people delay. And when they delay, what happens? The lens softens, the lens material comes out, causes inflammation, and then causes secondary glaucoma. We can also have neovascular glaucoma, secondary angle closure glaucoma, and phacomorphic glaucoma, in which the iris lens diaphragm moves forward to block the angle of the eye, causing rapid rise in intraocular pressure. Next slide, please. Next slide. In those having red eyes, there were 66 patients that had associated systemic diseases, mostly diabetes, hypertension, and sickle cell disease. And a few of them had tuberculosis, whooping cough, and sickle cell disease, and Stevens-Johnson syndrome. Next slide. Next slide, please. Okay. So we see that red eye is a common ocular sign. And we need to examine the person very well to make accurate diagnosis and treat. The redness is as a result of increased blood flow to the eye as a result of encountering some maybe injury or of invading organisms. So the redness, there are two types: the conjunctival injection, which with superficial vessels and is mobile and can blanch with vasoconstrictors. We can also have ciliary injection, in which the redness is from deeper vessels around the limbus and indicates that the eye may be having more serious things that can cause blindness, such as iritis, keratitis, and glaucoma. Eyelid disorders like inflammation of the eyelid margins, malposition of the eyelid can cause red eyes. We have mentioned chlamydia infection, bacterial, viral, subconjunctival hemorrhage. All these can cause red eyes, and cornea disorders with anterior uveitis associated with pain, photophobia, blurred vision, and maybe associated with HIV typing B27, sarcoidosis, syphilis, and Behçet's disease, with usually presenting with irregular pupil and keratic precipitates on the cornea. We can also have episcleritis and scleritis causing the red eye. Acute angle closure is commoner in Asians because of the anatomic configuration of the eyes. But even here, it occurs with severe pain, visual loss, and raised intraocular pressure. And at risk are elderly people who are long-sighted. Other causes include dry eye syndrome, dacryocystitis, and orbital cellulitis. So we need to take a good history, examine the eye very well, check the eye pressure, stain the eye with dyes such as fluorescein and other dyes. And we need, if you are a general practitioner or somebody that sees it, who's not an ophthalmologist, or you don't have facilities, patients who have acute angular glaucoma, cornea ulcers, cellulitis, chemical injuries need to be referred urgently to see the ophthalmologist. Many cases of red eyes may be benign, but others may be serious and cause blindness. We need to identify them early and refer to prevent complications. I just try to, for especially those non-doctors who are here, the eyeball, we are familiar with it, the eyelid, the pupil, the sclera, the iris, the ciliary muscles, the lens of the eye, the vitreous, the optic nerve, the muscles, the sclera, the aqueous humor. So just for especially those who are non-ophthalmologists who are here, for them to know that this is what we are talking about. Cross-section of the eye, when you cut it, this is what you see. And these are the things I'm talking about. When I say iritis, that is the iris inflamed. This is the lens, the cataract. It can cause cataract. The cataract can move forward or cause further complications in the eye. Now, practical cases, this is the kind of eye that we like to see, white, clear. The conjunctiva is clear and white, the cornea is transparent. You can see the back of the eye. Some patients come in with, when you invert the lid, see this as if somebody poured stones in that place. They are actually elevations that look like cobblestones. They can rub on the cornea and cause ulcer. It causes severe itching and discomfort in the eye. And the same patient, the eye is also brownish with limber hypertrophy. And also they have slimy ropey discharges. So it's common in children, and many parents are worried. What happens when my child is constantly rubbing the eyes and the eyes are brown? And again, some people who have allergic conjunctivitis, there's a social aspect to it. When they go to school and people see their eyes red, they say, Abi, they smoke something. Have you smoked something and your eyes are red? But it's not because of smoking something. is because of inflammation of the eye, causing all this that we have described. Also, we can have some ulcers that will just occur spontaneously in the eye as a result of various causes, including infestation with parasites. It's called ulcer. It can perforate, and if it's not properly managed, it lead to blindness in the eye. This one perforated with the iris coming out through the cornea. Also, we can have very rarely carotid cavernous fistula, which the vessels are dilated and there's whoosh noise in the eye as the blood is moving as a result of carotid cavernous fistula, which is a relatively rare condition. We have had patients that had redness and chemosis or swelling of the conjunctiva from metastasis from breast, from pituitary tumor, and other forms of cancers in the body. So we need to watch out. This child was playing with a colleague with a catapult, injury in the left eye, causing the cornea to become opaque and therefore loss of vision and blindness. This is why we are highlighting that children should be supervised as play so that this kind of thing does not occur and the eyes can last for us a lifetime. This gentleman is an epileptic who was ironing his dress, and while ironing, he suddenly developed grand mal seizures, and then the pressing iron pressed on the eye, causing what we have seen, affecting the cornea and the conjunctiva from epileptic fit. That is the same eye of that person. This gentleman was a scavenger, and they were trying to get the best position for scavenging. And as we said, the person hit him on the face, and you can see what happens. The eyelid was torn into shreds, and I had to spend some time to try and put it together. As many years back, about 12 years ago, this elderly man was in his house. This was the time when there were many armed robbers going to people's houses to disturb them. And what did they do? They used hammer to hit him on the face, and the right eye globe ruptured. And this was the presentation. And when we took him for examination, you can see that both the front and back of the eyes were badly cut and damaged, and there was total loss of that eye. Also, conditions that present like this, conjunctiva intraepithelial neoplasm, can present to us, but we need to know that this is something that is treatable. This particular person came because he couldn't see with the eye. The eye was very red, and it was also cosmetically unattractive. And we could barely see the pupil and the iris. We undertook the journey to remove the tumor. And after we removed the tumor, the vision improved. First day postoperatively to 612, and then continue to have improvement. Of course, when you remove such coverings from the cornea, you have an ulcer left, and you need some time for the ulcer to heal. So after treating, the ulcer healed, but we also had to do amniotic membrane graft, which improved his vision to 6/9 in that eye. The specimen was sent for histopathology, and it showed epithelial apoplasia, loss of goblet cells, loss of normal cell polarity, nuclear hyperchromasia, pleomorphism, and mitotic figures. Again, histopathologic features of that same patient, and another slide on histopathology. We had a mason, a bricklayer that was referred to our hospital as an emergency with sudden loss of vision. While he was looking for his daily bread, he was a mason just carrying concrete from one place to the other. He had only one good eye, and the other eye had been damaged by glaucoma. But what happened? While carrying concrete, he was disoriented and he fell on a piece of iron rod that pierced his eyeball and with blood gushing out. And we try as much as possible. He had a grade 4 penetrating injury involving both the anterior and posterior segments of the eye. And we tried to repair this. He also had lid laceration. We repaired. This was the left eye that was blinded, and the only good eye was the one that had this injury. So it emphasizes the fact that employers of labor need to ensure that the people who work with them, they wear protective eyeglasses, protective goggles, or even ordinary sunshade. Because if he was wearing even a sunshade, this would not have happened to him. And now he was blinded in both eyes. So we repaired the eye, but he couldn't regain function. When we did a B scan, it showed that he also had a retinal detachment because both the anterior and posterior segments were affected. We had a 6-year-old boy who was playing with his neighbor. He had a pencil injury and developed ifema in the eye. But luckily for us, the child was brought early. He was conservatively managed. The ifema cleared and the vision was restored. We also had a 39-year-old construction worker that presented to us in December 2015. He was in his line of duty and somebody used the elbow to hit the eye. But unfortunately for this, he waited and did not come on time. From 22nd September 2015, when the injury occurred, he didn't present on the 15th December. And when we actually examined him and said, look, we may need to do a washout and see whether the cornea can recover from this, he went on pilgrimage to consult people, and he went for religious pilgrimage for prayers. And by the time he came and we tried to, he had a normal left eye, we tried to save the eye, but we couldn't because the cornea became like this, imbibed. The cornea is supposed to be transparent. Once it is not transparent, it loses its function of vision and it causes blindness. This is why we are presenting this lecture, because we don't want people to be unnecessarily blinded by things that are obviously preventable. A 33-year-old male was presented with to our hospital with features of allergic bacterial conjunctivitis. And we examined him further. He had some drooping in the right eye. And when we looked at him, we saw that he had an organic foreign body in the eye, which was removed, and that improved his vision. And that is some days after removing the cornea. But he had a scar, but the vision was improved. We have been exposed to a lot of metallic corneal foreign bodies because people who are machinists, welders, and mechanics, I don't know why they don't like to wear goggles, even when they have them. Even when this material presented to them at their workplace, they still don't wear these materials and they suffer damage as a result. So if you are working with hammer, hitting metal and metal, some of it may chip off, enter your eye, stick to the cornea, and they usually will put their eyes in a bowl of water thinking it will come out, but usually it doesn't come out. So we have to really go and remove this, and then move the ring, the rust ring that follows, so that the patient can have good vision restored back to the eye. Again, we had a 40-year-old man who was self-employed. He was using an electric filing machine to file an iron brush. Patches from the brush flew into his right eye and got embedded, causing him instant pain, tearing, increased sensitivity to light, and making it difficult for him to open the eye very well. He had visited Federal Medical Center and then referred to us. The vision was hand movement in the affected eye and 612 in the unaffected eye. The eye pressures were not remarkable. He had ulcer and dermatitis of the face, and in the affected eye, the eyelid was swollen with ciliary injection. He had a foreign body embedded in the cornea into the eyeball at 2 o'clock. He had corneal abscess, keratotic precipices, and also hypopion with ephema in the eye. The pupil was photodilated. When we suspected metallic intraocular foreign body, we were wondering if we had an endophthalmitis with it. Of course, we could see the ephema and corneal abscess. We placed him on treatment, and then we took him to theater and removed the metallic foreign body from the eye. And gradually, also, he had raised intraocular pressure, which was treated, and the inflammation in the eye was also treated. And eventually, he got better from treating the various multiple complications that associated with this injury. And I will show you the photograph of this gentleman. So we can see that the eye, we had this metallic foreign body, and we had this swelling and abscess around it. It had ephema and some kind of abscess in the anterior chamber. And another close-up view of that same eye. And eventually, we did fluorescein staining and saw the cornea also abscess surrounding the metallic foreign body. And he had keratotic precipitates. And this is the metal that we removed from the eyeball, which penetrated the eyeball. About half or 3/4 of it was inside the eyeball. It was at the limbus, and 1/3 outside the eyeball. It was successfully removed, and then it was treated and managed, and then it got better, and his vision also improved. We also had another patient that came to us, also occupational injury. He worked as a factory worker at a plastic manufacturing company at Ijesha. There was an explosion of a gas cylinder. There was a deafening noise. And then he noticed that I couldn't open his eyes to see anything again. So by 5 p.m., they brought us to our hospital, and we saw that he had a lot of carbon particle pellets and fragments on the face, on the cornea, on the eyelid, and everywhere was hazy. And we started to treat him. And we did debridement. We removed the particles, and we gave him antibiotics injections, and the vision gradually improved until by the time he was discharged, he had improved vision in the eye. So I will show you the photograph of this person. This was as presentation to the hospital. You can see a lot of these black particles around the face. He couldn't open his eyes. And when we stained the eye, he had the ulcers. We had to remove the particles from the eyeball, from the cornea. And by the time we had treated him for 2 weeks, the ulcer had healed. There was no more corneal staining, and his vision improved. Again, let's talk about this 29-year-old lady. What happened? He presented to us in 2015. However, in 2006, he had cane injury to the eye from the parents. Again, this is very important. We like to correct our children using cane. I remember when I was younger, I received so many canes myself, but most of the canes landed on my buttocks. But some people, when they are trying to beat their child, they find out that the child will turn and the cane will do what? Hit the eye and cause injury. So that was the patient having damage to the pupillary sphincter and having secondary glaucoma also in the eye from that injury. There was a 21-year-old female who came to our hospital on the 28th of May. This lady worked at the bank and she usually went to the bank with the staff bus. But this particular day, the staff bus was not there. So at 6 a.m., she entered a Sienna bus. And inside the Sienna bus were kidnappers. And they extorted 3 million naira from the parents. And when they were going to release him, they rubbed Aboniki balm on his face and they now push him down. And when he came to our hospital, we found out that he could not open the eyes and he had corneal ulcer from the injury inflicted by rubbing Aboniki balm on the eyes. And so that is the patient who was treated and the ulcers resolved. Again, we have patients who have Stevens-Johnson syndrome, male and female, that were treated. It's important to realize that it is a rare cause of red eye, but it's something that happens and it's something that we have to really take care of. It requires multidisciplinary approach to treatment. This young boy at age 8, that was when we got him, but now he's at the University of Lagos and about to graduate next year. Vision is hand movement and perception of light in the right and left eye respectively. So that is the same patient with Stevens-Johnson syndrome. We also had another 12-year-old lady in 2011, but now she has migrated to Canada, who also had Stevens-Johnson syndrome. And what we did here was she developed symblepharon and antiblepharon and ulcers in the eye. And what we did is we did surgery for her. We removed buccal mucosa from the mouth and used it to graft the bulbar conjunctiva and under general anesthesia. And that helped her. And as at the last time she was seen, the vision was 6.5 in the right and 6.36 and improved with glasses to 6.18 in the other eye. So that is a photograph of the lady with the Stevens-Johnson syndrome. So we see that we need to prevent these disorders. We need to prevent these disorders by ensuring that we give information and education and integrate primary eye care into primary health care. Safety measures to be worn, protective goggles to be worn, and we need for those who have measles and all that, if they are taking measles vaccination, it will prevent measles affecting the eye and causing blindness. And also, we need training of manpower and retraining to prevent and manage complications. Masquerades, as we mentioned earlier, is depicting something that is like a deception disguise. And really, we have so many of them in ophthalmology. We are lucky we can look at the inside the eye and be able to identify so many diseases. And we need to really do this very well if to attain this goal of universal eye care in Nigeria. So we see that so many diseases, systemic diseases, present even first to the ophthalmologist. For example, this lady had diabetes mellitus, and also she had cataracts, and cataract surgery was done for her, but later she developed proliferative diabetic retinopathy in the eye. So that reduced her vision. She also developed diabetic foot, and this lady has actually passed on because of the poor management of the diabetes. So she had actually occlusion of the central retinal artery, and this led to very poor vision in her. We have also had patients who came with poor vision, and we found out that they had pituitary tumors. Some of them had binasal hemianopsia with high prolactin level. And for this patient, we could see the binasal hemianopsia, that is one field of vision at the nasal could not see, but the temporal one was seen. And MRI scan shows pituitary tumor, a macroadenoma in the eye. He was referred to see the neurosurgeon for treatment. And also, we had also another person who also had a pituitary tumor and also referred. You can see how big the tumor is. So these people presented with poor vision in the eye, and we found out that it was actually due to pituitary tumor. Again, pituitary tumor, if it is small, prognosis relatively good. If it is large, may require surgery, and the prognosis is variable. We also had a 71-year-old woman who presented with a swelling between the nose and the eyelid. And initially, she had some infection in the eye, which we treated. And later, we had to do an excisional biopsy of the tumor. And so that was the initial microbiology report for that stained for gram-negative bacilli, which we treated. But again, this did not improve. So we did a laboratory test, and results were essentially not very remarkable, but the electoral and urea was deranged. And then we did CT scan. We showed soft tissue mass in left maxillary antrum with extension to the orbit. We did the excisional biopsy and sent it for histopathology, and the reports came out to show that it could either be a poorly differentiated nasopharyngeal carcinoma or a lymphoma. Immunohistochemistry showed that it was a peripheral T-cell non-Hodgkin's lymphoma that she had. So we had lymphoma presenting to the ophthalmologist after she was treated. Blood parameters became better, and she is healthy and doing fine. That was the tumor that the patient presented with, and which was excised. He also had treatment with the oncologist, and after some time, it was satisfied that the tumor was completely removed and was no longer there, and she's living a very healthy life now. So those are the results showing that she was in total remission. Again, we have other cases like hypertensive retinopathy that we saw, and we treated over time. The patient had bleeding in the eye, and with treatment, the bleeding got resolved with some scanning of the retina. And we also have patients who had diabetic retinopathy. I'll go over this since I've mentioned one before, but I will just show us a picture of what she presented with. Non-progressive diabetic retinopathy, had exudates, blood and dots, hemorrhages. So people who have diabetes can have ocular complications and blindness as a result. So they need to be well controlled to ensure that they do not have ocular and other body complications, including that of the kidney. So these were hard exudates that we had. We also had a patient who was a prophet, had HIV and presented with tuberculoma of the eye. And she was seen over a period of time. And initially, the diagnosis, we saw a tumor, of course, in the retina. And she had tests that confirmed tuberculosis and also HIV. And that is the photo of the patient. We also had another unusual patient that had beta thalassemia hemoglobinopathy. She was resident in the UK, only came for holiday, and now developed poor vision in the eye. And she was managed also by the hematologist with various treatment modalities. She had also Fuchs pathology in the eye, but eventually, with all forms of treatment that was given, she had a situation where there was blockage of the vessels, and really the vision did not improve for her. So the arteries were blocked. All efforts that were made proved abortive, and the vision was just hand movement before she left back to the UK. We also had another patient who had cataract surgery done. So he was pseudophakic in both eyes and came to us with poor vision, especially in the left eye. And we decided to investigate with visual field tests, optical coherence tomogram, and the OCT was not really very remarkable. So we continued our investigations. We thought perhaps it was just the chronic simple glaucoma, or perhaps he had a pituitary tumor. And CT scan of the brain showed chronic ischemic vascular disease. And what we're trying to say here is that some people have poor blood supply to very different parts of the body, and this is what is responsible to poor vision in their eye. And the last case that I'm also going to present is that of an engineer who presented to us in December 2019 first with gradual loss of vision. He has also been on treatment for diabetes mellitus, and he was doing well. And until lately, when he reported to us, in fact, we were following him up with OCTs, which he did in 2019, 2023. We showed features of chronic simple glaucoma in the eye. And we just thought perhaps this was the only thing that was responsible for his poor vision. But when we investigated further, we found out that it was not just the glaucoma, but the fact that he had chronic infarcts in the brain as well as cerebral atrophy. So the final diagnosis from the brain MRI scan showed bilateral cerebral cerebellum, chronic infarcts, chronic small vessel ischemia, and cerebral atrophy. So, why this is being highlighted is that it is possible for us to focus on the eye, thinking, could this just be like, if we look at this patient, we will just think that perhaps this is just only the glaucoma causing the problem. But when we investigated further, we found out that it was as a result of atrophy of the brain and lacunar infarcts. So I will end by saying that the cases that we have presented are not the ones that cause blindness and low vision in Nigeria. Half of blindness in Nigeria is caused by cataract, another 25% by glaucoma. Cases like this with red eyes, masquerade syndromes, they cause irreparable damage, loss of vision. We need to watch out. We need to ensure that people come to the hospital and check their eyes if they're not sick, because many of these things can be picked up early, and blindness can be prevented, and visual impairment can be corrected. And have them. I thank you for listening to me.
Wow, wow, wow. A peep into the force majeure, masquerade, and attainment of universal health care. Another thunderous applause for our lecture. Thank you so much. Let's keep it on. Let's keep it on till he get back to his seats. Apologies for the people on the high table. We didn't know why there was a technical fault with the screen you are supposed to watch. Please kindly proceed back to the high table where you rightly belong.
Thank you very much, sir, again for that very enlightening lecture. Next, we'll call on the secretary of the faculty, in person of Professor Bola Adekoya, for the presentation of awards.
Ladies and gentlemen, can we put our hands together for the faculty lecturer again for the very stimulating and excellent faculty lecture? You took all down memory lane, sir. It is my honor and privilege, sir, to invite you to come to the podium to receive your faculty award for delivering the 26th annual faculty lecture of the Faculty of Ophthalmology, National Postgraduate Medical College of Nigeria. So I call on the faculty chairman, Dr. Charles Bekibele, to present this distinguished award to our 2026 annual faculty lecturer.
Congratulations. Congratulations, Dr. Festus Oshoba, 26th Annual Faculty Lecturer, titled Force Majoring Masquerades at the Attainment of Universal Eye Care in Nigeria. Today, Diola Nukoya, in recognition of her dedicated service as coordinator, Clinical Ophthalmology Update Course, Faculty of Ophthalmology, National Postgraduate Medical College, from the year 2000 to the year 2020. Congratulations.
Next on the list is Dr. Ogundipe. May I ask Dr. Professor Oluleya to come forward to come and receive this award on his behalf? He's unavoidably absent.
Award of Meritorious Service presented to Dr. Ayobade Ogundipe in recognition of your dedicated service as coordinator, Basic and Clinical Ophthalmology Update Course, Faculty of Ophthalmology, National Postgraduate Medical College, from the year 2016 to 2024.
May I respectfully call on Dr. SNN Nwosu for his award.
Award of Meritorious Service presented to Dr. Sebastian N. Nwosu in recognition of your dedicated service to the Faculty of Ophthalmology. Congratulations, sir.
So we had our annual quiz competition yesterday, and 3 winners emerged. It was keenly contested, but at the end of the day, we had 3 winners. And the last 2 winners, they had to be determined by a tie. It was a real battle between the 2 of them. But at the end of the day, we had 3 exceptional winners. So today we are recognizing them and giving them not only their certificate of being the first, second, and third positions, but also a little token from the faculty and the LOC to recognize their efforts. Please join me to go. Are they around? I'll start from the 3rd position, that is second runner-up, Dr. Jesumbo John Martins. Can you come for your certificates and cash prize?
Okay. Dr. Jesumbo John Martins, 3rd position, 26th Annual Faculty Lecture, Olabokpo Oshitoku Quiz Competition. Congratulations.
Okay, so second position, first runner-up goes to Dr. Oluwatamilore Faboya.
Dr. Oluwatamilore A. Faboya, 2nd position, 26th Annual Faculty Lecture, Olabokpo Oshitoku Quiz Competition. Congratulations.
And the first position, ladies and gentlemen, please put your hands together for Dr. Ambali Olamilekan Ambali. And this is not his first time of coming first in this quiz competition. Congratulations.
Presented to Dr. Ambali Olamilekan, first position, 26th Annual Faculty Lecture, Olabupo Oshitoku Quiz Competition. Congratulations.
Okay, so we have just one more award, just a minute. One more award to present. We have an award for Dr. Omoti. He's also unavoidably absent. Is there anybody from Uniben? UBTH? All right, thank you. The LO chairman will receive the award on his behalf.
Award of Meritorious Service. Presented to Dr. Afikede Omoti in recognition of your dedicated service as coordinator, Clinical Optics Update Course, Faculty of Ophthalmology, from the year 2004 to 2025. Congratulations.
Thank you very much, our faculty officials. You saw me whispering with. You saw me when I spoke with the chairman of my faculty. I was actually appealing that after this, Dr. Ambali ceased to perform or participate in the quiz. It's his third time of taking it. So he's now emeritus winner. Please, can we have the band give us an interlude while we get the next segment ready? Chairman LOC, please. Chairman LOC. Dr. Oti Aribaba, a mentor, teacher, friend, confidant, spiritual leader. Please, I want you to come and take over this segment.
Thank you. A round of applause to the band, please. Now it's time for goodwill messages. We would like to invite our own Professor, our mother, grandmother, doyen of ophthalmology, who, through the grace of God, has been able to train generations of ophthalmologists. And she is around today to witness another epic occasion of one of our mentees in the person of the distinguished faculty lecturer, Dr. Odunayo Oshoba. Please permit me to invite our mother, past president of National Postgraduate Medical College, in the person of Professor Dame Ajeshola Adepeju Jekumi.
The chairman of the occasion, please permit me to stand on the existing protocol. And I would like to sing a short song before I give the good message. And that is, what shall I say unto the Lord? All I have to say is thank you, Lord. What shall I say unto the Lord? All I have to say is thank you, Lord. Thank you, Lord. Thank you, Lord. All I have to say is thank you, Lord. My goodwill message today is to thank God for keeping me alive to be here. When I started the training of most of the people who are here today as ophthalmologists, I'm sure many of them wished me dead because I was very strict with them. And I have some stories which many of them, they even had a play when I was 80 to show me how I treated them during their training. But thank God, they are all big men and women, professors and so on. So I'm very, very happy to listen to one of them give this lecture. I remember Oshoba vividly. And I remember that he is a go-getter. When he wants something, he gets it. I thank you for this beautiful lecture. I came purposely to come and listen to Force Majeure. I thought you were going to present in French. So when you now spoke the language that most of us understand, I could see where you were going for. It has been a lovely lecture. I have enjoyed it. I have added more to my knowledge. One is never too old to learn. And I say that for all the others who are here, I am proud of you all. I will also like to thank the chairman who has accepted to be here. Thank you very much. God will stand with you. God will console your family. When I look at the high table, there's none of them that I wouldn't like to thank God for what they have achieved so far. But this is a lecture, faculty lecture. Mine was in 1994, and I just came back from a sabbatical then. So I had a lot to talk about. I look forward to next year, if God still keeps me alive, to probably go to Shagamu or where the lecturer will invite us. You can be sure if it is Shagamu, I will be there. Once again, thank you for inviting me. But I want to remind you that I want you people to do something. As a past president of the college, National Postgraduate Medical College, and the only one who has represented ophthalmology, I think you people should, because it is high time that we have another ophthalmologist as a president of the college. God will help you all. Thank you very much.
Thank you, man. Next up is Registrar, Medical and Dental Council of Nigeria, one of us, the brand new president, National Agency for the Prevention of Blindness, Professor Fatima Kyari. A round of applause, please.
Good morning, Mr. Chairman, Professor Majikudimi, ma'am, faculty, esteemed faculty, my seniors and colleagues, distinguished ladies and gentlemen, Mr. Chairman, sir, may I stand on existing protocol and what has been laid by Professor Majikudimi. When I came in this morning, I came in just as myself, a newly minted fellow of the National Postgraduate Medical College of Nigeria. And I thank the faculty leadership for that. But I was quickly reminded that I'm wearing several caps. One of which is being the registrar of the MDCN, Medical and Dental Council of Nigeria, and by that virtue, a member of the governing council of the college. But truly, I came here to honor Dr. Festus Oshoba, the faculty lecturer. And I come on behalf of the Medical and Dental Council of Nigeria. I was accompanied earlier here by the chairman, Professor Afolabi Leshi, who also came on several accounts, And I'm also accompanied here by my Deputy Registrar, Dr. Nnameka Wakama. We congratulate the Faculty of Ophthalmology on the 26th annual lecture. And we especially commend the lecturer, Dr. Festus Oshoba, consultant ophthalmologist, and several other things that we had this morning on his outstanding contributions to outstanding eye care, advancing eye care in Nigeria. And we also recollect his contribution as the past registrar, the 7th registrar of the Medical and Dental Council of Nigeria. He's 7th, I'm 10th. So unlike the college, the MDCN is well represented by ophthalmologists. MDCN remains committed to partnerships with institutions like this college, which is very key and integral to us in promoting high standards in medical education and practice. I just want to remind everyone here, the fellows especially, that MDCN has an ongoing effort to update the master register of all licensed practitioners, and we're going to publish this in 2025. Please, as fellows, as specialists, kindly update your information so that you'll be recognized as that. We celebrate the milestone of the faculty, and once again, thank you very much, the LOC, once again, the leadership, and distinguished ladies and gentlemen, thank you very much.
Thank you very much, ma'am. I've just been corrected that this is a national medical college program. Here we are all doctors. Not everybody is a professor. We are all doctors. So apologies if I not professor because we are all medical doctors here. We have another good read, I think the final one, because we have spent a lot of time, from one of us, also an enigma, a maybe fellow, very industrious. He is the first fellow by examination of the National Postgraduate Medical College, Dr. BGK Ajayi, who is unavoidably absent but sent his good read messages, which will be read by my co-MC.
Distinguished colleagues and friends, it gives me immense joy to witness the continued blossoming of the annual faculty lecture series, which I had the privilege of initiating during my tenure as chairman in 1994. The inaugural lecture, delivered by our revered mentor, Dr. Eniola Olasende Akinshete, laid a noble foundation for what has become a rich tradition of reflection, inspiration, and scholarly engagement in our field. I was honored to deliver the 9th lecture in 2006, The Beauty of Pain, which examined the deep struggles faced by our people in cataract surgery and the resilient spirit of ophthalmologists navigating this terrain. Today, nearly 20 years later, the challenges persist, but so does our commitment. It is with pride and hope that I commend Dr. Festus Odun Oshoba for his timely and thought-provoking lecture, Force Majeure, Masquerades and the Attainment of Universal Eye Care in Nigeria. There is a clear and powerful synergy between our themes, a testament to the continuity of purpose within our faculty. There is good news on the horizon. The Aletta Eye Institute, in partnership with CBM and Help Me See, is launching a simulator-based cataract surgery training program next August. This marks a new chapter in building the capacity we desperately need. I congratulate Dr. Oshoba, the faculty chairman, secretary, and the entire faculty board for sustaining this important lecture series and for preserving the Faculty Endowment Fund, which began alongside it. Together, let us keep the flame burning for our patients, our profession, and the future of eye care in Nigeria. Warm regards, BGK Ajayi, DFMC, past chairman, Faculty of Ophthalmology, National Postgraduate Medical College of Nigeria. Thank you.
Thank you very much. And applause for our first fellow by examination. I've done this before, but I will do it again since he's here in person. May I recognize the #1 ophthalmologist in Nigeria, the president of the Ophthalmological Society of Nigeria, a person of Dr. Abiola Uleye, who is now here with us. At the same time, I cannot do it but recognize all the chairman of subspecialty groups in ophthalmology, particularly my own chairman, Dr. Oladapo Onodipe, Vitreoretinal Society of Nigeria. Now we'd like to hear from the special guest of honor, his goodwill message, and that will be the final note where we shall try to round up this program. For those of you that are still online, thank you for still being with us. We are about to round up and we move to the second segment, which is socials. May I call on the chairman and the founder of the Eye Foundation Hospital Group, Dr. Kunle Azan, ably represented by my own friend, teacher, senior, a vitreoretinal specialist in the same Eye Foundation Hospital, Dr. Olufemi Oderilo. A round of applause, please.
Good morning, everyone. Please allow me to stand on existing protocol. Dr. Adenekon was saying that we're all doctors, but we know that some people are more doctor than the others. If I get into more trouble, let me read the goodwill message that I was sent to read. A goodwill message by Dr. Adekunle Azan on the occasion of the 26th Faculty of Ophthalmology Annual Lecture of the National Postgraduate Medical College of Nigeria. It is with great pleasure and deep respect that I extend my goodwill and warm felicitations to the Faculty of Ophthalmology, National Postgraduate Medical College of Nigeria, on the occasion of its 26th annual lecture. This prestigious lecture series has over the years served as a platform for thought leadership, academic excellence, and the advancement of ophthalmic education and practice in Nigeria. It continues to reflect the commitment of the college to excellence in postgraduate training and professional development. I heartily congratulate Dr. Festus Odunayo Oshoba, a distinguished scholar and seasoned ophthalmologist, on being selected as the lecturer for this year's education. His choice is both apt and commendable, and I'm confident that his presentation has been insightful, impactful, and inspiring to everyone in the audience. As we gather to share knowledge and celebrate the achievements of our noble specialty, may we continue to strengthen the bonds of professional camaraderie and mentorship and innovation that define the Nigerian ophthalmic community. This is wishing the faculty continued progress and success in all its endeavors. Long live the Faculty of Ophthalmology. Long live the National Postgraduate Medical College. Thank you.
Thank you very much, my soft-spoken boss. At this junction, we are now at the endowment and fundraising segment of this program. It is a very important segment. The Faculty Endowment Fund is a special fund that is set aside for the growth and development of training of ophthalmology in Nigeria. We are grateful to the chairman who has generously and wonderfully donated please, I can't call it, help me.
Not more than $125,000.
$1,000. Please, somebody check what is the exchange rate today so we can know the amount. Thank you so much, sir. We are very grateful. On our cards, on our brochure, we have pledge cards. On the first That's the inner front cover. You see a pledge card. Please kindly pledge towards the faculty. But I was hoping that the special guest of honor would be guest of honor. Okay. Oh, good. I had our first guest of honor, Dr. Kunle Hassan, has done normal. What is a normal? All right, if you know that means he has done as expected. He always deliver. Please, all our seniors, our friends of the lecturer, the iBank, the University of Ilorin graduate families, the mainland clubs, please, Egbe Bobakeye, this is where we need you to support our faculty lecture. Please kindly look at the inner page. You see pledge card, kindly pledge. The usher will go around to collect it from you. I'm tempted to call somebody to come and pledge. This paper is not working. Please, who do we call?
We can start with you.
All right. On my honor and in my space as the MC, I hereby declare that money that is supposed to be given to me for this MC should be donated to the program. Over to you.
I second you, sir.
All right. I think without wasting much time, I would like to call on, like I introduced him earlier, but this is another level of introduction. My HOD, my trainer. I don't want to say my everything because that's my wife, but he is near that and almost that. A very amiable man, soft-spoken, gentle, flexible, always. The chairman, LOC, Dr. Olufisayo Temitayo Aribaba, for the vote of thanks of this segment. And for those who are yet to get their small chops, I can assure you it's coming. Here we serve it hot in Lagos, freshly made. So it's coming. And after that, we are going to have a cookie down social section. So they know that ophthalmologists, we play hard and we party hard.
I would like to stand on existing protocol. Most importantly, to thank my colleagues. Dr. Olayinka, Eunice Agbola, and Dr. Adetunji Adenekon for a good job. After this, we would like to invite the anchor, the MC, coded CFR Boluwatife Ogunbono, to come and do what he knows how to do best. But before we move to that, I would like to thank God Almighty for giving us a serene weather, the grace and the opportunity to be alive to witness today. I would like to thank our chairman for accepting to share this great occasion. Sometimes when we have colleagues, when you invite them, some people may feel, well, they've moved on. That was medical school. But our chairman came in today and presented his foundation in memory of his darling wife, and I decided to partner and support us as Ophthalmical Society of Nigeria. Another round of applause, please. We would like to thank the president of the National Postgraduate Medical College of Nigeria, ably represented by the Deputy Registrar Academics, our own Dr. S.S. Sule. At the same time, we cannot stop thanking our teacher, our mother, grandmother, great-grandmother, great-great-grandmother, because we have many, sometimes Prof will ask us, who is this one? They will now have to start tracing the family trees and tracing the genealogy, like as is written in the book of Matthew. This one begot this one begot. Prof. Dame Professor Ajitola Majekodumi, the Otun Iyalode of Okeona. Otun Mama is I don't know, Kakafo's wife of Okeona Egba, a mother of many parts. We all wish you well, ma. None of us wish anything bad to happen to you. Because even with that, we were known for discipline, and that really helped us. That really helped us. The saying then was a go for show. But people wonder when we go for exams, how we manage to pass. But few of our colleagues that have visited us at our sabbatical now realize that, look, there's a lot of hard work going on in Lagos because of the foundation laid. So we are very grateful, ma. It's our prayer that the good Lord will continue to grant you good health and be with you and all that are yours, and that you won't have any cause to weep or mourn over any one of us in Jesus' name. Thank you very much, ma. We have in our midst the social guest of honor, Kunle Azan, who has been there for us as past chairman, Lagos OSN, past president, National Ophthalmical Society of Nigeria, who, one way or the other, has contributed enormously to ophthalmology practice and profession in Nigeria. Ably represented by Dr. Denilo, the MD of Eye Foundation Group of Hospital. We are very grateful. We didn't take this for granted, knowing your busy schedule. Please send our message to Oga that we are appreciative of your support and your dedication. At this point, we want to recognize and appreciate the faculty lecturer for next year. Dr. H.A. Ajibode donated 100,000 naira to the faculty fund. A round of applause, please. And that's a challenge, a big challenge to the faculty lecturer for this year, so that next year, I'm sure my big brother, friend, and mentor will retaliate in Shagamu by God's grace. We want to thank the faculty officers, the faculty chairman, the faculty secretary, the third Senate member, and all distinguished fellows who are here. All of you, gown and ungown, all of you left your practices, you left your patients, all of us know how busy we are. Most people, when they come to eye clinics, they see the crowd, and they are wondering, well, and I said, no, that's the way it is all over the world. The eye is the soul of the body. And if the eye is blind, then there's nothing. May the good Lord continue to preserve our sight, and may we be with each and every one of us in Jesus' name. I want to thank the faculty lecturer. All of us will understand and see the passion with which he delivers his lecture. One thing that is very important is that he had records, pictorial records of all his patients, monitoring their recovery with time. That trend, linear trend of patients' record is rare. Very few practices in our climb have that amount of, that level of data. And so, distinguished fellows, anytime you are writing your textbooks on tropical ophthalmology, and you need pictures and diagrams, please feel free to reach out to the faculty lecturer, because he has enormous data on tropical ophthalmology, both anterior segment and posterior segment, and pictorial diagram that will tell us of what is going on, the trend of our patient. At this point, we want to appreciate all the exhibitors. I I won't like to mention names so that you won't say LOC has a favorite. We appreciate you all for coming to exhibit your products. And I can assure you, our fellows that are here with the guests on the high table, we pass through your stand to see what you have to offer. Without you, we won't be here. A round of applause for them, please. At this point, I would like to thank the Army Band that are here. We are very, very grateful for your music, and we know we are moving to high life so that you treat us to good high life, and all of us will dance as we move to the next phase. So thank you very much.
Thank you, sir. It's nice having you lead us. Please, ushers, can I have the pledge cards very quickly? Very, very quickly. Let me have the ones in your hands so I can announce them. We are raising funds. Thank you. Please, more should be coming. Of course, the #1 ophthalmologist in Nigeria has also done normal. He has donated the sum of 100,000 to the project of the endowment fund in Dr. Abiola Oyeleye, 100,000 naira. He's going to reiterate that the next faculty lecturer, that's for next year, immediate past chairman of the faculty, also donated 100,000 naira. This is not just donated, he already paid, not just pledge, already paid, it's in the account. Please, I want more pledge cards. If you have them, just bring them. Ushers, no standing, get me the pledge card has been filled. And you can go on a solo for us. Solemn.
Sum of 50,000 naira has been pledged by Dr. Olatunde Bakare from General Hospital, Badagry. Thank you. Let's keep it coming. Let's keep it coming. We have some naira from Dr. Gloria Patrick Ferife. That's the Vice President OSN. Thank you very much, ma. And another 50,000 naira from Dr. Lawumi Otusoya. Please, let's keep it coming. Let's keep it coming. Okay.
I have to announce this one because it's coming from the Vitros. My Oga Dr. Oluleye Tunji, HOD Ophthalmology Department UCH, has donated the sum of 25,000 naira to the project.
A sum of 100,000 naira donated by Dr. Akpama Akune. Thank you very much, ma.
Any other pledge cards? Please kindly fill the pledge cards. We would like to announce you and we would like to follow you up with it. And please don't forget to drop it. Do not take them away. So in case you don't have the wherewithal to do that right away, we'll be able to follow you up. I think the small chop seems to have gone round. That's appetizer. We'll be getting you the main course very soon. So, ladies and gentlemen, I would like us to move now to end of the program where the band, we will soon need to be on our seats.
Thank you very much. We have another sum of 20,000 naira from Mr. Deji Abiodun.
Chief Usher, please, can you get the faculty lecturer back to his seat? Anybody that's supposed to be on the item should please come back because we will soon have to do the recession.
Yes. We have another sum of 20,000 naira from Bumi Johnson, paid already. Thank you. A sum of 50,000 naira from Ebony Eye Specialist Clinic. Thank you very much. Oh, thank you, sir. Okay, a sum of 50,000 naira from Dr. Nwosu. Thank you very much, sir.
All right. We have with us a friend of the faculty, in person of the chairman, faculty of orthopedics, Dr. Sam Eyeson, ably represented here by Dr. Ite. Dr. Ite, please kindly let's recognize you. That's a friend of faculty of ophthalmology from the faculty of orthopedics. Please, can any of the members of the LOC get me the faculty lecturer to come back to his place because we are waiting for him to do the recession. Anybody in the LOC, kindly chase him for me. Oh, don't track him, chase him. Chase is more Nigerian. A good message from one of our mothers as well, Dr. Adefule Oshitelu, who had the plan to be here. I just got a message, but due to unforeseen circumstances, she had to sort those things. We appreciate you, man, in absentia. And if you're online, I'll just deliver your message. Yes, here's the big man. Because if he's not in, we can't do anything. We need you back on your table. So I don't know. Is the registrar MDCN left? The MDCN registrar has left. MDCN. All right, thank you. So right now we are going to have the national anthem, following which there will be a recession in reverse order. It were in front when we're coming in. Now you are going to be at the back. Just test as it needs to what it needs to be at the back in reverse order, please. So we have the high table and all national postgraduate medical officials, followed by the faculty. Then we have our descending order of your year of graduation. So if you are the last, we know that you just newly graduated. All right, band. The recession is not the end of the day. It's for you to finish the academic section. So you go out, for those who are wearing gown, remove your gown and come back in for the social. So we have finished fraternity and spiritual things. Then we move to social. Band, national anthem.
May we all rise for the national anthem? Now we proceed with the recession in reverse order. Thank you. Please. Please, there'll be buffet after the recession. Let's just put our gowns outside, come back in for buffet and Mary.
Hello, your balance. You know the story. Now, can we have the MC decoded? Question of what Ogu to do best. MC Codex. This is the social section. Please do not go. We have a lot for you in stock. It's TGIF. I go now. Let's retire back into the hall, please. Let's retire back into the hall, please. Thank you. We still have buffet and a lot to eat and drink. Please, let's come back to the hall. Let's be seated. Thank you. All right, music. Thank you. Thank you, music. Thank you. Thank you very much. Thank you. Please, ladies and gentlemen, let's come back into the hall. We still have some other things to do. Please, we have food, drinks. Please, a couple of windmill music. Please, let's come back into the hall. Please, ushers, please tell those outside to please come in, sir. Thank you. Let us come back into the hall. Thank you very much. Please, ladies and gentlemen, let's have our seats. We have food and drink to enjoy after so much talk, discussion, lecture, beautiful presentation, awards, and all that we've had, ladies and gentlemen. Of course, we have to put some things in our stomach to keep us alive. Thank you. Please, let's let mommies and daddies come back into the hall. Please, let them come back into the hall. Thank you so much. Ladies and gentlemen, doctors have always having a lot of preferential treatment everywhere. That's how it is. Back in the days when we're in NYSC, that's how they put us in one side. You know, you are in the medical line, come to this side. It has always been like that. So we are used to it. We are used to doctors being treated more than us. It's normal. During NYSC, there's a way they will say, oh yeah, if you know you are studying, you studied medicine, anything medical line, come to this side. Other courses, come to this side. So we are used to it. Back in NYSC days, anytime they want to drill us or they say that we should come to the field to come and do morning jogging, morning devotion. All medical personnel will go into the clinic. That's how they do it. All the army officers, they will blow whistle, blow trumpets, wake us up. All those ones that are in the medical line, they will move gallantly, majestically. They will not even run. Oh. Anytime the army officer say, "You, what are you?" I'm a doctor. It has always been like that. So we are used to doctors